Medicare data shows that the number of Aussies visiting medical specialists has fallen 10% since 2019, and that's partly because costs for initial appointments in some cases can be upwards of $900. In response, the government has committed to putting thousands of specialist doctors' fees online so you can shop around. I spoke to the CEO of Private Healthcare Australia, Rachel David, a little earlier.
We've had some concerning data that we've had a look at recently from Medicare, which shows that over the last 5 years, medical specialists' first consultations have dropped by 10%, even as Australia's population has grown. And we've had data from a range of other organisations, including the ABS and La Trobe University, which shows that between 10 and 20% of people referred to a medical specialist are not attending because of the cost. We've seen from what we've seen from inflation is that the medical specialist out-of-pocket costs that occur in their consulting rooms, which are the ones that the health funds can't cover, have escalated rapidly above inflation. And it's a real deterrent for people actually seeking even their first appointment. This is flowing through the whole system to the extent that it's even causing private hospitals problems because they can't sustain the same occupancy as they've had prior to the pandemic.
And just give us a sense of how expensive some of these appointments are for Australian healthcare customers.
Well, look, there is a huge variability around the country. If you live in an area where household incomes are high and the number of doctors are constrained, like in some of the regional areas, Canberra, the Gold Coast, the Mornington Peninsula, you're much more likely to have a high out-of-pocket cost than in areas where there is more competition and household incomes are lower. In some specialties too, like we've seen in psychiatry, for mental health, people being charged upwards of $900 for an initial consultation and maybe half that for future consultations. We had some data released yesterday by an organisation called Clean Bill that put the price of a first dermatology appointment, so a skin doctor, at between $200 and $300, and that's only one appointment. If you need a lot more, or you have a number of conditions that need specialist care, you really could be up for thousands of dollars by the end of the year. And this is really challenging for people in a cost of living crisis. So it's understandable that they're putting off seeking medical care, but it's having really bad consequences for them as their condition worsens or they have to go on a waiting list. And it's having consequences for the business of private health as well. So private hospitals are struggling because there are just simply fewer patients.
Yeah, and that, for example, that psychiatrist example you mentioned where upwards of $900, just explain how much of that potentially Medicare might cover, how much the private sector might cover, or is none of that covered at all?
Look, you will get some back from Medicare. I think for first consultation, it's $200 odd that you get back, and a little bit less for further consultations. But that in no way covers the entire amount. And we know that the federal government, is sufficiently concerned about this that they actually promised prior to the election that they would publish specialist fees on a government website called the Medical Cost Finder website. And that would make it easier for people when they're having a discussion with their GP about being referred to a specialist. If they raise cost as being an issue, then the GP has a source of information they can go to so they can refer people to a specialist who is more cost effective for them.
So basically appointments are becoming unaffordable for quite a large proportion of Australians now with this cost of living crisis. But what can actually be done about it, Rachel? How do we fix this?
I think the federal government is taking a really important first step to address this, and that is to publish specialist fees on a website called the Medical Cost Finder website. They have a lot of data in the Department of Health that can be made available, which shows medical specialists out-of-pocket costs for across a whole range of procedures and appointments. So I think that's a very important first step. So when people are talking to their GP, it's important that if cost is an issue for them, that they raise it so that if they are referred to a specialist, it doesn't come as a shock. There are obviously some other issues that need to be addressed, and certainly inflation has been a problem across the whole economy. The government has been doing everything it can to put downward pressure on inflation, but they are specialty areas where we just simply don't have enough doctors. And that in itself is driving costs up as the workforce becomes more and more constrained. So that's another thing that the federal government has looked at, getting other types of healthcare professionals to do some more of the work through a review that it's done of scope of practice, and also in some cases bringing in some more highly qualified medical specialists from overseas and attracting more doctors to Australia to work in some of those areas where more competition is required.